Hi everyone, this is Laura Pegram from NASTA. I just want to let you know that we have a few people on the line. We're going to give it probably 3 extra minutes, maybe 4, if we're feeling generous before we go ahead and get started. Thanks for joining. And you all should be on mute at this point. If you're not, please go ahead and check and make sure that that's a real thing. And we'll touch back in just a few minutes. Thanks. Hi everyone, this is Laura at NASDAQ. I just want to let you know that we're going to give just a couple more minutes for folks to get on the line. Everyone who is an attendee for this should be muted, and so we will check back in just a few minutes, getting a few more folks. Thanks for your patience. All right, I think that we're going to go ahead and get started. So for those of you who just joined, again, this is Laura Pegram, Senior Manager of Drug User Health here at NASDAQ. I'm joined by Virgil Hayes, who's a manager on our drug user health team here at NASDAQ, and also Zach Ford, who's a program manager at AIDS United. So thanks so much for joining and spending a part of your afternoon walking through the request for proposal about the SSP patient navigation demonstration project that is a component of PS 19-1909, a larger umbrella of the SSP TA Center, which is a 3-year cooperative cooperative agreement that NASDAQ, in partnership with AIDS United, was awarded just about a month ago. And this is one component out of many. You also were probably aware that when I sent out those RFPs, that was plural, and the other RFP is a request for proposals for potential TA providers, technical assistance providers, and that is much more straightforward than this one. So we wanted to make sure that we offered a space to go through the RFP in more detail, and have try to answer any questions that you all might have as programs and individuals who might be applying for this RFP, this part of the TA Center. I have to warn you, this will probably be very dry, but we are just going to walk through the RFP in total and give you some of the background and just offer a space. Of note, this is being recorded. I've gotten a lot of requests from folks who are interested in having this, live for forever in posterity, but who couldn't make the webinar today. So we want to make sure that we offer a space to really field questions, answer them if we have answers at this point, and we will follow up with any answers that we don't have in this moment. We will also make those in transcript form available on our website as soon as we can. So just quick agenda. We're going to go into NASDAQ, AIDS United, who we are, what we do. We're going to go through the overview of the RFP, how to apply, attachments that are required and will be necessary if awarded, and then open it up for Q&A. Of note, the best way to ask a question, since you all are on mute, will be in the question box that you should see or into the chat box that you should see on your screen. All right, so about NASDAQ. We typically use the acronym, but it stands for the National Alliance of State and Territorial AIDS Directors. We're a nonprofit, nonpartisan, membership-based organization that primarily works with HIV and viral hepatitis state health department programs across the country. We provide a range of different services, including creating resources, bringing trainings, bringing technical assistance, advocating for state health departments, on the Hill, or consulting on local policy. And we really recognized several years ago that there was no way to complete our mission to end the intersecting epidemics of HIV and hepatitis if we didn't meaningfully incorporate a lens about drug user health and supporting the health of people who use drugs. So this program has been around for about 2.5, 3 years now, and has expanded. So it's expanded the reach of our work more broadly. Zach, do you want to go ahead and tell us a bit about AIDS United?
Absolutely. Hi, everyone. Zach Ford here from AIDS United. For those that don't know, I oversee our harm reduction portfolio, including the Syringe Access Fund. Really excited to be working with NASTA on this project. So at AIDS United, our mission is to end the HIV epidemic in the United States, and we do this through strategic grant making, capacity building, policy, advocacy, technical assistance, and formative research. We lead the charge for responsive and effective federal, state, and local policies that benefit people living with and at risk for HIV. And we invest in innovative models to meet the needs of communities affected by HIV. And we've given more than $100 million in direct funding, and we've leveraged around $117 million to increase capacity of communities and organizations responding to HIV in the US. We work to inform the field with best practices, lessons learned, and we advance advocacy based on sound public policy. Strategic grant making to affected communities, targeted and tailored capacity building for organizations responding to the epidemic, and research and evaluation to inform the field. And we do all of this within a social justice framework that challenges the foundational issues of racism and sexism, homophobia and transphobia, socioeconomic inequality, gender discrimination, and stigma.
Great, thanks, Zach. So we just wanted to kind of give a little bit of background about where this component of this larger cooperative agreement comes from. So this will be no surprise for most of you on the line, but we know that SSPs and syringe services programs play a really critical role in linking folks who are using drugs to a variety of different services, both medication-assisted treatment, other behavioral health interventions, treatment and testing for hepatitis, HIV, wound care, the list goes on and on. We know that currently a majority of SSPs offer referrals already to all of these different services, but often capacity is an issue. And so recognizing that the National Center for HIV/AIDS, Hepatitis, STD, and TB Prevention, there's an acronym for that too, and the Opioid Response Coordinating Unit at the CDC put some funds together to create and funded through this Technical Assistance Cooperative Agreement, NASDAQ and AIDS United, to basically implement sort of a sub-project within this that is focused on developing patient navigation programs within currently existing SSPs, and really just, I think, trying to provide a space to just really demonstrate the potential impact of these programs and what could be possible if there were adequate, real intentional resources there. So the whole idea here is to really identify what, as it's a demonstration project, so the whole idea here is to really identify what those key elements in improving linkage to care and navigation to care for people who inject drugs and people who use drugs to all of those services. We're hoping to create, basically develop what best practices are that might be replicable for other programs or more broadly. So that's sort of the background, and the purpose here is really where we're at. And I'm going to go ahead and pass it back over to Zach.
Great, thanks, Laura. So for this project, we're going to be awarding 8 organizations funding, and each award is going to be $100,000. And then there's going to be several eligibility requirements that you must meet in order to apply. So your SSP must be located in areas where accessing MAT is possible and with support from a patient navigator. You must not have a formal patient navigation program already in place, but you should have the capacity to start one quickly. And we're looking for organizations that come from diverse parts of the US, from urban, suburban, and rural jurisdictions, and you must be located in a jurisdiction that has a determination of need concurrence from the CDC. All right. So patient navigators should be in regular communication with NASTA, who is responsible for organizing monthly calls and providing technical assistance. So in addition to providing data and tracking outcomes, patient navigators should be prepared to share success stories, which are going to be included in quarterly reports. Programs will be expected to work collaboratively with NASTA and AIDS United throughout the project period. And sites are expected to participate in the site evaluation process and collect and report at a minimum on the following: the number of clients who spoke with a patient navigator, number of clients who requested navigation support, types of navigation requested, patient navigator action, and then what barriers were encountered and how they were addressed, including things like, did they provide information about a referral? Did they set up an appointment for the client? Did they take the client to an appointment? And then also answering what the follow-up was and what the outcome was. So in the selection process, the final selection of sites will be based on access to medication-assisted treatment, a demonstrated ability to implement patient navigation, demonstrated ability to collect and transmit data required by the project, and a demonstrated ability to engage successfully with clients of a syringe services program. And again, on the selection process, so funding will be obligated through contracts with NASTA to selected sites, and they will be managed on a monthly cost reimbursement basis. So the performance period for this contract is expected to be February 1st of 2020 to September 30th of 2020 with the potential for a no-cost extension. Applicant organizations should be prepared to demonstrate that they have cash on hand to support the project in the period between incurring an expense and receiving the reimbursement, and typically that will take around 30 days.
Hello, everyone. So I will be presenting the application logistics. So with the application and submission information, I just want to first start off by saying the email that participants will be sending their application to will be included in the RFP that is sent out. Application materials will not be accepted through fax, mail, or express delivery. So make sure that you check that email once you get your RFP. The maximum narrative length should adhere to the amount listed in the RFP. So using 12-point font, proposal should strive to provide complete information as these following questions serve as a review for the criteria. And the total length of the application should not exceed 6 pages. And that includes your project narrative, your budget documents, and your letters of commitment, and other attachments are not included in that 6-page limit. So organization specific questions, right? So organization types that are eligible are CBOs, ASOs, faith-based, human rights, clinic, medical providers, legal aid, and other. Total organizational budget should be rounded to the nearest dollar for the current fiscal year. Summarize your organization's mission in 2 to 3 sentences. Also summarize your geographic area that is served, whether it's urban, suburban, rural, what have you. General client profile should include age, gender, race and ethnicity, socioeconomic status, and self-identified sexual orientation, and also self-identified HIV status. So the total amount that is requested, and this is a flat rate of $100,000. Summary of the project should be 2 to 3 sentences maximum. Program profile. So for this section, you want to make sure you have syringe access services in operation and put the month and the year. Annual syringe services program budget. Now, this is the amount. It may be the same as your total organizational budget, and above if your organization is a standalone SSP. Epidemiological data that you want to include. Examples are data on drug-related HIV infection in your community, data on drug-related HCP infection in your community, drug-related endocarditis in your community, and drug overdose rates in your community, and other relevant community epidemiological information. Staffing. So the questions below ask about staffing levels at your organization. So we want to make sure that you please indicate the number of the staff who work on your SSP, as well as the number who work in your organization as a whole. So for some applicants, these numbers will be the same. And we're looking for the number of paid full-time staff at your SSP, the number of part-time staff, the number of volunteers, the number of paid full-time staff at your organization, as well as the number of paid part-time staff at your organization, and the number of volunteers at your organization as well. For the narrative portion, we're going to be looking for you to provide a comprehensive description of how your organization will implement the proposed intervention that is consistent with the program model. So you want to make sure you include a summary of the benefits that are anticipated for your organization and clientele, as well as an overview of the agency's ability to successfully meet program expectations. So in the narrative, you want to briefly describe your current operation, including recent major accomplishments, specific challenges that may be faced. Please do not tell us the value of the syringe programs in general. More specifically, we would like for you to focus on describe your specific program, please, and also summarize any public health data that is specific to your geographic program area. Also, describe how you plan to use the requested funds to create a program navigation program. And within that, you want to include specific goals, activities, outcomes that are stated as measurable terms. You want to explain why this funding is critical to your program, and also what additional value will be added if you receive funding. We're also looking for you to describe the HIV, viral hepatitis hepatitis and overdose crisis that is taking place within your area, and how you intend to serve through the proposed project to address that. And that section of the narrative should include a brief description of the barriers related to meeting the needs targeted by the project, a brief description of how your organization will address these barriers, and finally, data on services provided that are related to the project, if any, and that can demonstrate the need for the project. So a narrative section should also include an overview of the agency's ability to successfully meet program expectations. So under this, we want to include, ask that you please describe your organization's intervention based on the level of requested funding. Now that should include a proposal of how the project might be adapted to fit your organization, what strategies are you going to use to ensure successful implementation, and exactly how your organization will engage a substantial number of clients for this project. And please be sure to describe how your organization meaningfully involves people for the project. Describe how your organization meaningfully involves people for the project, and please describe how your organization meaningfully involves people who use drugs and people living with HIV and viral hepatitis. Describe what the outcome and impact of your organization would look like to achieve the project. Please describe your organization's experience and capacity to collect client-level data and conduct data entry. And please, we ask that you reference the evaluation requirements in the program expectations section and clearly describe your organization's ability to meet those requirements. Attachments. So for the attachments, and once again, this is not included in the as a part of the 6-page length of the proposal, but we want to make sure that you include the completed budget template. Do not use any budget form other than the one provided by NASTA. Organization's current annual operating budget, including expenses and your income, and a completed diversity table. And please do not use any form other than the one that is provided by NASTA. Now, if you are awarded, some other attachments that we would like to see, most recent audited financial statements, including cover page and the auditor's notes and findings. Negative audit findings will be considered in funding decisions. And a list of your fiscal sponsor's board of directors with professional or community affiliations. Now, if the organization does not have a board of directors, then we're asking that you please send your fiscal sponsor's board of directors list. And if neither is available, then we would ask that you send a letter of explanation to explain.
And one quick note there, actually, that there's a sentence that I forgot to take out, but this slide here is actually attachments that if you are awarded, we will expect about within a timely section after. So negative audited findings actually won't be considered in funding decisions. Sorry for that.
So does anyone have any questions? If you do, we ask that you please include them in the chat box.
Mm-hmm. Thanks for that, Virgil. Yeah, so there are two options here. You can go into the chat box and submit a question to the presenters or to the entire audience, or you can submit questions through the question box. Both are accepted. Let's go ahead and give a couple minutes there to allow folks to enter in questions. I think that if there are questions that come up as you delve further into the RFP more intensively, the RFP has an email, druguserhealthta@nasdad.org, that's listed in it several times, and that's where you would direct those questions. So we'll go ahead and just give a minute here for folks to type in questions. again, just as a reminder, this recorded webinar and any questions that are asked here will be displayed for everyone's availability as soon as we can get this processed on our end, and I will send that out to the listservs. So we have a question here of, do we have to have an audit to qualify? So the answer is no and yes. So an organizational audit or an audit of your fiscal sponsor will be required if your program is awarded. We wanted, going into the thinking about this RFP, we wanted this to be a reasonable lift for programs. So we didn't want to over ask if in the early stages of application. So for the initial application, the answer is no, you do not have to have an audit to qualify. You need to be prepared to provide one within a month at the very latest after award, if awarded. Good question. We'll give a few more minutes just in case there are other questions. Okay, great. Well, hearing none, I don't want to take up any more of anyone's time in this day. So thank you everyone for attending today, for your interest in this project. It's a really exciting potential opportunity for folks, and it's really our pleasure to help facilitate this process and really work with 8 exceptional programs on this. So here is our personal. Here are our professional or work emails, and again, I realize right now we should have put the drug user health TA at NASTA, nastad.org email on this slide, but it is in the RFP. So feel free to reach out to that email in particular if there are more specific questions, and this will be posted by early next week on our website, on the same landing page where the RFP lives. So thank you so much for your time, and I hope that everyone has a great day.